Oh, you're welcome. My name is Dr. Humbert. You're welcome. How can I help you? And why? What are the reasons why you came here today? Thank you.
Okay, thank you, doctor. My name is Sarah and my mother is Judith. I have come here because of the complaints that my mother has. My mother has been on several drugs for so many years. She was diagnosed to have hypertension, they said diabetes, then hypothyroidism. I was also told that she has the lipid in her blood is high, that is hypercholesterolemia, and then also she has a gastroesophageal reflux, that when she eats, the food she ate regurgitates back to her throat. So all this has been worrying us, and then recently she now complains that she has muscular pain in her shoulder. She also, now because of this, she was placed on so many drugs. So when she wakes up in the morning, she has been having frequent urination, and then on getting to urinate in the bedroom, she has this unsteadiness, and then she feels like she wants to fall. There's a near mixed fall, and then recently too, her stool has been watery. So all this has been giving the family concern. So we are worried and then thinking of, because I've been the one administering all the plenty drugs that she was given. So we are worried and thinking that we should take her to home care where she can be taken care of. So that is why the family said I should come and see you, the doctor, for advice on how to care for our mother.
Thank you very much. All your complaints have been noted, and we are going to discuss with you so that we'll have a way forward for your mother, Judith. Like you said, she is on plenty medications. The reason is she's an elderly person, and they have this what we call multimorbidity. Multimorbidity is in plenty illness at the same time. Usually it's common in old age. And the drugs for all these medications are the reason why these drugs, even though I noticed some things, based on the screening tools I used to evaluate her, there's a screening tool for all the medication that elderly takes. We call it screening tools for older person's prescriptions, and also screening tools for appropriate treatment in the elderly. So I use this, and I also, the list of medications you've given to us, I discovered that there is a problem. If you take a lot of drugs at the same time, you usually have what we call adverse drugs reaction because of the effect of one drug and the other one. But many drugs have their own side effects, and people take the side effects, drugs to treat the side effect of other drugs. We call that one cascading or prescription cascading. And I noticed also this, your mom has that prescription. She was placed on amlodipine first. Amlodipine have the risk of pedal edema, or what we call angioedema. Exactly. And from there, she was given, what do we call it, hydrochlorothiazide to take care of that. So that is the reason why they prescribe that drugs. And also for the diarrhea that she has, amlodipine on itself has the risk of constipation. And I also noticed that she is on paracetamol and paracetamol with codeine. So there are two drugs at the same time. So we need to remove one and leave. So this codeine that she has, and also the amlodipine, can bring constipation. And constipation with sometimes the body knows how to handle it. You discover that she has diarrhea. And probably I think that's the reason why she's having that. So we're surely going to review this drug. First, we're going to remove amlodipine from these medications. If we remove amlodipine, then certainly hydrochlorothiazide will go. I'm going to leave her with lisinopril because it is very good because she's diabetic, it is renal protective, and it's going to help her maintain a very healthy kidneys that she has. So we'll leave that. Then for the L-tyrosine, we'll leave it. Then for the muscular pain she's complaining, is one of the side effects of simvastatin, that is the drugs that you take for the hypercholesterolemia or the increased lipid. So with time, we will taper this drug and probably reduce it to 10 milligrams. She's now currently on 20 milligrams, and this muscle. And the paracetamol she's taking is going to help her with this, just paracetamol, that's acetaminophen, is going to help her with the pains that she's having all over her body. I think basically that is that. Then concerning the issue of her being transferred to a nursing home or not, we have to respect her wish. She will have to ask her and ask if she wishes to stay there. And there are also indications why you take somebody to nursing homes. If there are no indications, most times we respect her wish and we also keep her there. So for the time being, removing these drugs, I think is going to take care of the symptoms, and If there are issues we need to modify, we will do that with time. So I don't know whether you have any other queries or questions that I'll be able to address.
Thank you, doctor. Now I understand why she has most of these symptoms. I really appreciate and we are grateful. We'll look at it, we'll reduce the drugs. I'll get back to my siblings to tell them what you have said. So is there any time we are going to come and see you again to know if there is any improvement with the medications once we reduce it and those symptoms, if they are going to reduce?
Exactly. So you are going to see me in the next 2 weeks. So after 2 weeks, you come and you review these drugs. Then also, the issue of falls that you talked of the other time, removing this drug also would give her more stability because she doesn't have to go back for evaluations and all of that. So by so doing, we're reducing the risk of fall. Like I said also, the falls are very detrimental to elderly and we don't want those issues to that. So we'll see you in 2 weeks' time and we'll do our best to make sure that she's okay. So thank you very much.
Thank you so much. I will do as you have said. We'll tell my siblings what you have also said. I will hope that there will be improvement.
Yes.
I will come in next 2 weeks. I'll come along with her.
Thank you very much. You're welcome.
Thank you so much.